Welcome everyone to today's webinar, Flexibility Wins, the Healthcare Strategy Driving Revenue, Recruitment, and Retention. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I will first walk us through a few quick housekeeping details. We will begin today's session with a fireside chat, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see in your screen. If at any time you're having trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box as we are here to help. At this time, it is now my pleasure to introduce today's speaker. We are joined by Wayne Lipton, Managing Partner of Concierge Choice Physicians. Wayne, thank you for joining us today. I'll turn the floor over to you to kick us off.
Thanks to Becker's Healthcare for this webinar, and welcome. First, a few things about myself and about Concierge Choice Physicians. I founded Concierge Choice Physicians 20 years ago, supporting physicians offering concierge care to their patients. We work in all over the country, in fact, also internationally, in 28 states, offering strategy, support, and marketing for concierge programs. A little bit more about myself. I'm also a board member of Malloy University, one of the nation's largest nursing schools, and I spent 10 years on the board of a major hospital. I also managed and created a large IPA in the Northeast for hundreds of physicians. Thinking back about the beginnings of concierge care, I remembered having designed and implemented one of the first institutional programs of concierge care at Tufts New England Medical Center. That goes back around 20 years ago. So let's start today and talk a little bit about the definition of concierge care. It's been used to describe everything from practices that charge administrative fees to referral services and even to direct care. But for CCP, for Concierge Choice Physicians, it's a membership-based model where patients pay for an annual non-covered service and receive a variety of desirable benefits while almost always using their coverages to pay for all the other services of the practice. I want to talk a little bit now about the history of concierge care because it really began with a full model of concierge care. Back in 2005, I read a GAO report about doctors who were doing this model. Only about 150, I think, at that time were doing it. Most were doing full models where all the members, all the patients were members of the program, or just about all. And a few were doing these partial approaches. And I thought that the partial approach was important and possibly a vehicle for more physicians to participate and to use its benefits. I coined the phrase hybrid program at that time and started the company in 2005. Let's take a look at where we are today. Especially larger healthcare delivery organizations are experiencing more and more challenges. Historically, you rely on higher rates of compensation, particularly if you're a dominant player in your area. But the future of government rates and support is really in question, as are commercial rates. It's a battle that's been fought for years and years and years. In fighting that, the issue of revenue versus expenses, you may be relying on upstream revenue from specialists, diagnostics, procedures, and facilities to fuel some of the losses or cover some of the losses. In some instances, there have also been more emphasis on the data and less emphasis on the interaction between the doctor and the patient, or even the provider and the patient. So what do we have now? Well, we have some physician burnout. Seeing more and more patients is often not the answer. In fact, it reminds me of a story of a doctor I met. This goes back toward the beginning of the company. There's a doctor in the Keys who was working late one night, and he said, look, I'll have to talk to you the next day. So in the morning, we got together and chatted. He said, you know, yesterday I surpassed a level of patients that was like my record number of patients that I'd seen. And I said, well, how many people did you see yesterday? And he said, I saw 70 patients. That was pretty astonishing. So I said, how'd you do it? And he said, well, I started at 8:30 in the morning and I didn't finish up till after 9 at night. And I saw 70 people. So I asked him, what was the quality of the care like? And he said, oh, it was terrible, but I saw 70 people. Now, I thought that was terrible, quite frankly. I thought this would not be a person who wants to do concierge care. But I think it speaks to the issue of more volume of physicians and other providers pressured to see a large number of people, because that's been the solution for how to generate more revenue, to be more productive. Also, administration is pressured to address the economic challenges that they face, and you also have disgruntled patients at this time. The wall between the patient and the provider has never been greater. And now, if your compensation is dependent on patient satisfaction, well, that's yet another problem. So our contention today is that concierge medicine is a way to address these pain points. Concierge medicine really does work in a vertically integrated healthcare system. First, it's a program that's funded by patients themselves. It's not paid for by plans. You control the price point, not a third party. You continue to charge third parties and also collect fees from private insurance. You'll learn today that the structure of the model can be very flexible. Hybrids can be for a handful of patients to a few hundred members. Full models can be from 100 to 600 patients, where almost all the patients are members. And there's a whole cornucopia of things in between. Concierge is not a one-size-fits-all. There's flexibility in design. And most importantly, it's not in conflict with the traditional referral-based model. In a hybrid program, the doctor continues to see all their patients. It does not reduce productivity, it increases the productivity. And for the time that the doctor is spending with concierge patients, there's a high level of revenue. It's a high valuable period of time for them. And like software, for instance, it's a subscription approach. It's recurring revenue. Recurring revenue today is a vehicle that's used in lots of things. I mean, there's recurring revenue in many, many different products that you used to buy and now you rent effectively. And most importantly for physicians, revenue that comes from a membership is not subject to seasonality, holidays, vacation, or weather issues. It doesn't require additional location, staffing, or investment. It can work side by side with other traditional practices. And it really does work with government programs and private insurances. The difference between a full model and the hybrid is that there's flexibility. As I said earlier, it's not exactly the same for each and every physician who performs a concierge program. But we learned early on that where it started in primary care, in internists and family physicians, it gravitated about 5 years into our company to some specialists. We found that specialists were interested in the possibility of enhanced revenue. And it worked particularly well for certain types of specialists who were almost acting as primary care doctors. We didn't ask them to be primary care doctors, they were still specialists. But if you had a particular issue, like dealing with a cardiac issue, your cardiologist may have been the primary doctor for you. The specialists, like cardiologists who became concierge doctors, did it in a hybrid approach because they still needed referrals to fuel their practices. But they found it to be very successful. We expanded that into GI doctors, to endocrinology, rheumatology. We even figured out a solution for pediatrics, which is a bit challenging. Remember, the doctor still charges for covered services by a third party or the government. Small blended programs, these hybrid programs, can generate millions in revenue without major structural changes. And I think that's rather important. As an example, if a practice adds 100 members and they charge, let's say, $2,500 per year, that would generate over $200,000 for that practice. So if you think about a primary care practice that might generate somewhere around, say, $800,000 to $1 million, maybe a little more, maybe a little less, adding $200,000 of revenue to that practice is a significant benefit. Concierge programs like this are a win-win-win situation. It's a win for the employer because there's a significant benefit economically and other things we'll talk about shortly. There's also a benefit to the patient because now they have additional compensation. And it's a win. And they also get to perform the services in an environment that's somewhat ideal. The patients actually benefit too, because the benefit that comes to the concierge member does not prevent it from generating a benefit to the staff and also to the patients who are not concierge members. Now, membership pricing is interesting because when it first started off, it was about $1,500 per member per year. And there was one unique program out in Seattle that was charging, I think, $20,000 per patient. That was a unique, odd type of concierge program. But the standard program started at about $1,500 per member per year. We currently work with practices that charge anywhere from $1,800, I think there's one that's $1,600, to upwards of $10,000 per member per year. But our experience helps decide and helps make appropriate recommendations as to what price makes sense for each physician, for each practice, based on the market conditions, the patient population, and to some extent, the nature of the current practice. Healthcare organizations see concierge medicine as a key to physician recruitment and retention as well. While physician burnout is one of the biggest challenges that healthcare organizations face, the drive for individual volume can only cause more burnout. What does physician turnover mean to you? Well, according to a March 4th healthcare white paper, the potential cost for filling a physician position can top $500,000 when accounting for loss of potential billings and money needed to recruit that position. And concierge medicine is an excellent way to improve physician retention. It's a desirable way to practice. It's a way that physicians can slow down the pace of their practice, even if it's for a small portion of the day. And frankly, they love the benefit of spending more time with their patients, almost always does. There's professional satisfaction. It incentivizes the physician to choose to work for you, if you make that available to them, to stay with you, and it offers greater satisfaction. It does produce productivity increases without sacrificing quality. When it comes to senior physicians, you can retain your senior physicians when they either do a hybrid or a full model of concierge care, because it does slow down the pace. And I can tell you that many senior physicians today are thinking about retiring early or getting out as soon as possible, because frankly, they may not be able to be as productive as they would like to be. But this way they can serve as a mentor to their other physicians. They can be seen as a positive example of what's possible. And frankly, they can continue to see the patients they really enjoy seeing. It's a very positive way to go. And we have many doctors who have extended their careers years beyond what they would have normally. And for an employed situation, this is highly valuable. When you go for physician recruitment, many of our clients are using the opportunity to practice concierge medicine as an incentive to attract new high-quality physicians. Physicians do want to practice, many physicians want to practice this type of medicine and are intrigued by the opportunity. And it's a way for you to differentiate your organization from others in your competitive marketplace. And your competitive marketplace may not just be in your geography, it may be in a lot of other geographies where a physician is considering locating. Given the choice, physicians prefer one where the incentives are greater, and the incentives are greater when a concierge option exists. When starting a concierge program, there are pitfalls and there are some landmines. I can say from experience, you only get one bite of the apple. There are lots of issues that you have to deal with. There are regulatory and contractual requirements. There's questions about what's the appropriate physician compensation model. We've talked a little bit about price point. It's not just about the fact that you can control the price point. It's about choosing the right price point to meet your goals. In some instances, it's a matter of having a large price for a very small number of people, or a smaller price to have a greater number of people in the program. Concierge medicine is true sales. It's not just making something available. You can't just put up a display and say, here, we're doing concierge care. You can't just put up a sign and do that. It requires people on your staff who are very good at selling a program. And my question to you is, how many on your staff are great salespeople? And the answer is probably not that many. The wheres and hows of this are marketing decisions. Those are issues. But one of the big surprises about concierge care is because it's recurring revenue, it's very important to manage retention. Retention is probably one of the most important parts of the design and work in concierge care. Most most entities that have gone into it don't think about retention. They certainly do after a year or two, when all of a sudden the revenue model isn't generating for them. So how do you deal with that attrition? How do you generate growth? There's issues of collection versus sales. In billing is about collecting a fee. In collecting monies for a concierge program, it's about the sales. It's an opportunity to retain sales and to grow sales. We also recommend that you don't look to joint venture this opportunity with other entities. You own it. It's about your benefit. You shouldn't have an endless contract, and we don't offer that kind of a thing. Think of it as you have an asset. You have an asset that you can recognize and turn into value. You have a choice. You can do it yourself and perhaps get a small benefit. If you want to maximize the benefit, you need certain information, certain expertise. You have a missed opportunity if you're not doing it now. You have an asset. You should realize the value of that asset. Think of it as a gold mine, and you have a chance of using a spoon to get a little bit of gold out of it, or using some expertise to get ample amounts of gold out of your gold mine. Remember, your competition will be doing this. And if you're not doing it, you will be losing out. The decision to do this is not an issue of investment. It's an issue of strategy. Our company is the most experienced in using hybrid programs and various approaches to concierge care. And I think that, our clients have been some of the largest systems in the nation, some of the most prestigious hospital systems, and also independent physician groups. You invest nothing, you gain a lot. We help to get physician buyout and also the potential physician buy-in and patient buy-in, and that is really our job. So I hope today you've heard a lot about concierge programs within your system, and I hope to hear from you very soon. Thank you for the opportunity to talk.
Great. Thank you, Wayne, for sharing your insights today. We will now begin today's question and answer session. Audience members, you can submit any questions you have by typing them into the Q&A box on your webinar console. Let's get started with the first question here. Wayne, how do you achieve appropriate buy-in for a concierge program launch on the part of boards, physicians, and ultimately patients?
Well, for boards, it's first looking to who else is doing it. Oftentimes, a board is a risk management entity. And so the good news is that we have clients all over the country, and they can hear from those clients and get a report of how it's working already. So that's the first piece of the puzzle. You can't just tell physicians, okay, do it, because physicians have to make an emotional and physical commitment to the program. And so it requires interacting with the physicians, explaining to them what is required, what is recommended, and getting them excited about that program. And that takes a lot of time and energy. It's not just the boss says do it. And then ultimately, the final sale is to the patients, to explain to them what the value proposition is. And we have tens of thousands of members at this point and have a tremendous experience with letting people know what the value proposition is. And frankly, many of them like to have relationship medicine, and that's what concierge care is. So from the physician side, it's a little tricky. It takes some time to make sure they understand what it is, and it can't just be a dictum from the top. It has to be something that they're willing to and interested and excited about doing.
This next question is asking, what impact does concierge medicine have on value-based care? Do you have any insights you can share about this, Wayne?
Well, value-based care is about trying to assess the effectiveness of care based on the cost. That's at least the way I see it. In value-based care, there's nothing better than patients spending more time with their doctor. The outcomes are significantly better. The buy-in is better. We find that in concierge programs, the patient performance statistically is better. We just think that it's a way to generate value. And part of the measure of value from my experience with quality groups at the hospital is satisfaction. And there's nothing better than a physician who's performing concierge services to have enhanced satisfaction. So from a value-based proposition, I think it's actually a great way to improve it.
Thank you, Wayne. Now, from your experience, how long does it take to launch a concierge program?
The great delay is in the decision making. So right now, those of you who are listening might be saying, oh, this is a great idea. I think we should do this in the next year or two. The truth is, there are some entities and some groups that have made decisions already, and they're on their way to opening up. It doesn't take more than a couple of months. It could be anywhere from 3 to 6 months. If someone said, can you do it tomorrow? It still takes a few months to put together all the bits and pieces. But we're able to do it in a short period of time. And we don't have a waiting list right now, but it's rapidly filling up.
Great. This next question is a two-parter. First, are there some physicians who are better suited for concierge care? And what kind of physician is successful in this type of model?
In a full model, it takes a lot. You have to have relationships already to lever on. And in a full model, not everybody can be successful in a full model, particularly if they really haven't been giving one-to-one care before. But in a hybrid model, success is not measured by whether you get a small number of patients or a large number of patients to join. We have a lot of systems and large groups where the patient population that joins varies. There could be 200 in one doctor, 100 in another doctor, 50 in the third doctor. And it depends a lot on the supply and demand. It is a supply and demand product. So if in fact it's very difficult to get an appointment, it's very difficult to get the physician, it's very difficult to navigate the system, more people will join. So success is not about, in a hybrid, success is I'm going to do it and I'm going to be happy with the number of patients that I think are possible. We as a company do a lot of diagnostics to be able to predict how many people will join based on past history. So we know in advance what's going to happen in a practice, but success is not about the personality entirely, except in a full model where personality is very, very important. Personality in front of a patient.
Got it. Wayne, we have time for one more question. This attendee is asking if a concierge practice can be built from scratch, or is it something that can only be done by converting an existing practice?
In its original days, in the early days, in fact, that's what we did at Tufts New England Medical Center. You can build something from scratch. You can say, okay, I'm going to locate this office here. I'm going to hire a new doctor. But there's a cost involved in that. And there's a ramp up period. It's not like it happens overnight. So if you say, okay, we're going to build this, we're going to have a new doctor do this, you got to be prepared for some serious cost, much like it would be for any regular practice. So if you were to start a practice anew, totally an island separate from anything else, it's a lot different than adding a particular provider or doctor to a group that already exists and has a need for more patient availability of the doctor to the patients. I think the answer today is it's a little bit easier to do it, but there's no question that the transition from an existing practice to one that offers concierge programs is still the most cost-efficient way to go. But we actually are doing some of the others now, more of the build it and they will come approach, as long as there's a clear understanding of what the budget is for that type of an approach. By the way, we also have done this with nurse practitioners, and my prediction is that nurse practitioners will become more and more involved in concierge care in the next 5 years.
Great. That is all the time we have for today. For any questions that were not answered today, the CCP team will be sure to follow up. And on behalf of Becker's, I want to give a big thanks to Wayne for an insightful presentation and to Concierge Choice Physicians for sponsoring today's webinar. To learn more about the content presented today, please fill out the post-webinar survey. Enjoy the rest of your day, and we look forward to having you join us for future webinars.